My name is Sarah Sharp, and I'm the Animal Rescue Veterinarian for the International Fund for Animal Welfare. I'll be presenting today on behalf of my co-authors that you can see here on the slide on the right whale deaths that have been documented in U.S. waters since 2019. I'm going to start right off with a huge thank you to the right whale necropsy team leaders, Alex Castidis, Kim Durham, Bill McClellan, and Michael Moore, as well as to the stranding networks that continue to do this tough work, and to NOAA for UME contingency funds that helped offset some of the costs of these necropsies. I would also like to encourage you to view Dr. Hendrik Nolan's talk on the injured right whale calf response that I'll reference briefly later, as well as Dr. Deb Fouquier's talk on the right whale unusual mortality event. The first dead right whale that I will discuss today was reported on September 16th, 2019, floating approximately 4 miles off of Fire Island, which is on Long Island, New York. The whale was identified as Snake Eyes, a 40-year-old male, last seen alive up in the Gulf of St. Lawrence on August 6th of that year with a significant entanglement. When the carcass was found at sea off of New York, there was no entangling gear present. A necropsy was led by AMCs on September 18th with assistance from IFA and the Center for Coastal Studies. At necropsy, the animal was in advanced decomposition with no baleen and almost no skin present. Very few internal organs were available for examination, but the most significant findings were from the external exam. This image here is looking back from the distal tip of the rostrum towards the head. You can see the blowholes at the top of the image. And here along the upper left lip, you can see multiple linear abrasions. These abrasions continued over the dorsal aspect of the rostrum and onto the right lateral surface, wrapping that rostrum. And if we zoom into that yellow circle area, you can see those linear abrasions a bit better. And in fact, these lesions match those that were observed during Snake Eye's last live sighting up in the Gulf of St. Lawrence. You can see that line crossing the rostrum there. Linear abrasions also extended out of the gape of the left mouth and then to that left pectoral flipper, wrapping around the pectoral flipper. The right pectoral flipper also had a complete wrap with abrasions at the cranial insertion and a deep laceration at the caudal insertion of that flipper. Histopathology confirmed multiple sites of abrasion with some evidence of chronicity and collagen degeneration, which may be a result of continual pressure by the rope on the soft tissues. Due to the lack of internal organs available for sampling, underlying disease cannot be ruled out for this case. Ancillary diagnostics have not yet been run, but are being considered currently. In summary, we know that this animal was last seen alive in the Gulf of St. Lawrence entangled 7 weeks prior to being found off the coast of New York with no gear present. We don't know what happened in the meantime, and we don't know this animal's ultimate cause of death. However, the severity of the entanglement lesions meet the criteria for probable cause of death for this case. The second confirmed mortality case was reported about 5 miles off of Elberon, New Jersey on the 25th of June of this year. The carcass was landed 2 days later, and a multi-agency necropsy was led by Dr. Alex Castidis. This animal was identified as the 6-month-old male calf of catalog number 3560. Now, this mom-calf pair had been tracked extensively in March in the Gulf of Mexico, and he was last seen alive off of Cape Lookout, North Carolina. Since his death, his mother has been seen alive up in the Gulf of St. Lawrence. At necropsy, we found 3 distinct vessel wound patterns with variable degrees of healing, which you can see here on the dorsal surface of the whale. Wound series 1 consisted of 24 roughly parallel propeller chop wounds extending from the tip of the rostrum to the caudal thorax. Wound number 25 consisted of a single roughly linear defect along the dorsal aspect of the abdomen through which soft tissues had prolapsed at sea. Wound series number 2 on the dorsal peduncle consisted of at least 9 propeller chop wounds and a roughly linear scag or rudder wound that transected them. Based on the chronicity of these lesions and their location, wound series 1 and wound 25 were considered to be from a single vessel interaction that occurred weeks prior to death. Looking at wound series number 1 on the head, you can see that it transected the distal rostrum in multiple places. The baleen is completely transected as well as the rostrum itself, and the distal tip is actually reflected off to the right side of the animal there. And in fact, when we looked closer, we found multiple compound fractures of the maxilla and premaxillary bones. You can see those fragments in my hand here. And then the fractured surface of the bone actually showed red to black discoloration indicative of a bleed in the bone that was healing and resolving. The white coloration and rounded wound margins are also visible here and indicate healing that occurred over a few weeks' time. This animal's acutely fatal injury was wound series number 2. This dorsal view of the peduncle shows the propeller wounds, which were visible on both the right and the left lateral surfaces of the peduncle, suggesting the propeller essentially traveled across or through the peduncle. The propeller trauma also caused hemorrhage in the muscle and crushed the neural arch, which is the part of the vertebra that protects the spinal cord dorsally. Spinal cord goes through that hole there. So this likely resulted in significant spinal cord damage or severing of the spinal cord and tail paralysis for this calf. There was also no evidence of healing at this wound site. Histopathology supported the gross findings, including the estimated wound timelines. The head wounds showed evidence of chronicity on the order of weeks, including necrosis of the involved bone, which you can see in the image on this slide. While the peduncle wound showed evidence of a supravital response and no evidence of healing, indicating an acute trauma. Ancillary diagnostics for this case have not yet been run. So in summary on this animal, the older injury to the head, while not immediately fatal, was catastrophic and likely would have resulted in eventual death of this calf due to sepsis and or impairment of the feeding ability of the animal. The new wound on the peduncle severed the spinal cord and the epidural redi, or the vessels that run over the dorsal aspect of the spinal cord, and likely resulted in caudal paralysis as well as exsanguination or bleeding out for this animal. The wound location across the dorsal ridge of the peduncle suggests that the animal was alive and in normal sternal recumbency at the time of impact. This wound is considered the proximate cause of death and likely occurred within 2 to 3 days of the animal being found dead. So these next 2 whales are actually not part of the official body count per se, but are just 2 of the 11 current serious injury cases for right whales. This first case had propeller wounds reminiscent of that case that we just reviewed. And this animal was identified as the 2020 calf of derecha and observed off of Georgia and Florida in January of this year. So this is the animal that Dr. Nolans will be giving a full presentation a bit later on, the intervention that was mounted. And I'm just going to focus very briefly on a few of the propeller wounds. Specifically the injury to the left rostrum. And you can see it in all 3 of these images here. So this is an injury that is showing tissue displaced off to the left-hand side of the animal. And in this image here, this dotted yellow line actually indicates where that tissue should be laying. So it was across the dorsal aspect of the distal rostrum. In this top image, you can actually count, if you zoom in, 30 baleen plates that are affected here that are reflected back and exposed. So we estimate approximately half of that left baleen rack is actually avulsed or ripped off of the skull and would have continued to devitalize and fall off, leaving a gaping hole in that whale's mouth and obviously a serious concern for its long-term survival. In this bottom left image, you can see this pink tissue here, which indicates that actually the surface of the bone itself is being torn off along with the soft tissue. And then finally in this bottom right image, when I get rid of that yellow line, you can see this pointy white protrusion at the tip of the rostrum here. That's actually the premaxillary bones that are exposed. And so that's the animal's skull is exposed. Anytime you end up with bony exposure in salt water, there's a high likelihood that infection will set in and subsequently ascend and cause the animal sepsis and eventual death. As far as I'm aware, this calf has not been recited and is presumed dead at this time. And finally, this case was just reported on Monday, October 12th. This is a chronically entangled right whale that was first observed off of New Jersey and New York on October 11th. You can see the entangling line here. On the left body, just above the scapula, you can make out a large and very deep cavitary lesion in this yellow circle here. The exposed blubber and muscle appear necrotic, and this lesion will likely continue to extend into the thoracic cavity and kill this whale with saltwater intrusion in fairly short order if it does not die from sepsis first. So this here is the continuation of the dead right whale patchwork, and we're now up to 81 deaths since 2003, and this doesn't even include the presumed dead or serious injury animals or the deaths that are never documented at all. The tragic thing is that we know that vessel strikes and entanglements are catapulting the species towards extinction. We've known this for years, and yet these whales continue to die these horrible traumatic deaths. Huge thank you to the Stranding Network and Disentanglement Agencies and to the North Atlantic Right Whale Consortium who made this work possible, and for your attention today. Thank you.